This episode is brought to you by my fertility awareness programs. Master fertility awareness and improve your menstrual cycle health at the same time. Head over to fertilityfriday.com/workwithme for more information. That's fertilityfriday.com/workwithme. This is the Fertility Friday podcast, episode number 175. Welcome to the 175th episode of the Fertility Friday podcast. Thank you for joining me today. I'm Lisa from fertilityfriday.com, and this is your source for information about the fertility awareness method and all things fertility. I'm excited to be here with you in the final episode of 2017. I can't believe how quickly this year went by. It really feels like it went by in a flash. And so I want to wish you a very happy new year, because New Year is just in a few days. And if you're listening to this in the future, it's already New Year's. So I hope you're having an amazing year. And hey, you may be listening to this episode in like 2019. But at the time of this recording, we're still in December of 2017. And I'm really excited actually to end the year with this particular interview. So in today's interview, I'm actually interviewing a woman named Traci Johnstone. And she wrote the book, The Dangers of Depo. And so I think someone actually posted a link to her book in maybe my Facebook group or something like that. And I followed the link and grabbed the ebook and decided that I wanted to have her on the show. And so Traci had a pretty negative experience with Depo-Provera. I would say that of all the possible experiences you could have with it, Traci's experience is kind of like the worst case scenario. Like, it's pretty bad. And I think that it's important just to create a space to talk about these experiences, not because every single woman who uses Depo or any other type of hormonal birth control is going to necessarily have the same experience. But I think it's important to know that it is possible to have a negative experience. And I think that for any of you who've listened to the podcast for quite a while, you'll know that I'm really big on informed consent. So, in my perfect world, every woman would be fully advised about all of the potential side effects of any drug, really, but in particular, hormonal birth control. Hormonal birth control is often not really even thought of as a drug. And most women are not advised of the wide variety of side effects that can and do happen. And I find that with hormonal birth control, often we're being advised of some of the bigger side effects, like the life-threatening ones. And although that's really important to know about, the more common side effects that many, many women experience it's what we're not being advised of. And so I feel quite strongly about that. So I'm really excited to share this episode with you. And I'm really happy that Traci was willing to come on the show and share her story with us today. And so at the time of this recording, if you're listening in real time, I'm gearing up to start my next 10-week fertility awareness mastery group program. I'm so excited to welcome all of the women into the program. We're starting our first week together the second week of January, and we'll be meeting with each other every week until March. So I'm so excited to jump in and get started. Depending on when you're listening to this, the registration may be fully closed, but if you're still wanting to get in under the wire, there may be a few spots open. So just head over to fertilityfriday.com/group program. And if you see the page is open, it means that there's still spots available. And then if there's more of a landing page or a wait list, apply for the wait list, then that means that registration is fully closed. So just head over there if you're still wanting to jump into the group programs. If it's open, you'll see it. And if it's not opened, you can always jump on the wait list for the next group that will be starting later on in the year. And so without further ado, let's jump into today's episode. And today I'm very excited to welcome my guest, Traci Johnstone, to the show. Traci is the co-author of The Dangers of Depo, the world's most dangerous birth control. It's a new book about injectable contraceptive. Her book was released in July of 2017. And so together with Dr. Poppy Daniels, this collaboration resulted in an easy read. I'm holding the book right now. And Traci is also the founder of depotruth.ca. And if you're on Twitter, you can look her up at depotruth, which is an online resource for women to learn about the injectable contraceptive. So Traci herself took Depo in 2010 and is still struggling with the effects to this day, which is why she wrote the book and is passionate to share her experience with Depo. So without further ado, welcome to the show, Traci.
Thank you so much, Lisa. I really appreciate you having me today.
Well, you know, I came across, I can't remember how I came across your book. It may have even been in like a group someone posted that your book came out online. And as soon as I saw it, like I grabbed the ebook. So you sent me the copy, but I actually grabbed the ebook before you even sent me the copy because I just wanted to see what you had to say because it was a whole book about Depo. And you had some things to say. So
well, thank you for purchasing the book. That's great. Thank you.
Well, you're welcome. On the show, I've done a lot of what I call pill bashing. And so, I'm often talking about hormonal contraceptives, and I often kind of group them together and talk about them. Recently, I did a show about IUDs. And so I suppose where we're going is to get into a more specific, talking about specific types and really kind of fleshing out how they're different. And so I would just like to start with your story. I want to hear your story with Depo. So you wrote a book about it. So obviously there's a reason for that. So what was it about your experience that compelled you to write this book?
Well, I think it really stemmed from that my story is only one of so many. So while I was going through all of it in the earlier years, there wasn't a whole lot of answers. There wasn't a whole lot of support. There was very little information online. And you have to keep in mind, this is almost 8 years ago. And as I went along and I started finding more and more women with similar stories, I was compelled to actually, speak out and to put this book together to include not only my own story, but, other women's stories and felt that co-authoring with Dr. Poppy Daniels was very, very, or would have been very beneficial for women because not only were they getting the perspective of a past user, but they were also getting the input from a doctor that had seen all of the effects firsthand with her patients. So I think if we're looking at what essentially happened in my experience, I'll just briefly try and put that in a little tight nutshell if I could. I've had an awful life-changing experience. In short, Depo caused acute adrenal suppression. It wreaked havoc on my hormones. It destroyed my fertility. I experienced many of the known side effects. I ultimately lost my uterus. My teeth and bones experienced rapid decay. The ongoing infections that I've had are due to suppressed immune system. And as I share in the book, they essentially snowballed into critical conditions. The effects of this drug have been ongoing for me. I only had 2 injections in 2010. And I'm still, 8 years later, almost 8 years later, trying to restore my hormone health and heal my adrenal glands. I've been left with a critical hormone imbalance, which is quite common. Severe adrenal fatigue, premature menopause, osteoarthritis, fibromyalgia, kidney disease, the list goes on and on. But I'm going to circle back here and say my story is only one of so many. So many women have been negatively affected, which is why I had to write this book. Women need to know. And many of us weren't told about these side effects, warnings, post-use reactions before taking the drug. And Lisa, that's a problem.
Mm-hmm. Well, and that's something that I focus on the show a lot. It comes up, it's a kind of a common theme in a lot of the episodes where I do my aforementioned pill bashing, which is that a lot of the most common side effects are not even mentioned. So to some extent, we know about some of the life-threatening ones, blood clot, stroke, and even with Depo to some degree, bone loss. But the more common side effects that more women experience, like if you took all the women who had ever taken Depo, the most common side effects that they all experience are just not mentioned to us. So based on your personal experience and your research, and of course the information in the book, what are some of the most common side effects that women experience on Depo in particular?
That's a good question. So I think for starters, we're talking weight gain, hair loss, irregular and or prolonged bleeding, pain at the site of injection, vision changes, fatigue, acne, hot flashes, headaches, insane mood swings, loss of libido. And again, that's just for starters. So those would be, I think, probably one of the, or some of the most common side effects, but that list does go on and on and on. If we want to just keep going just a little bit further with that, Depo comes with not only many side effects, but in many cases, stopping Depo causes a lot of problems. And there's actually a term called Depo withdrawal. And that, not only do we have to contend with the side effects, but then the risk of experiencing Depo withdrawal after using it. And then there's a long list of post-use reactions. And in the book, we've tried to, cover all of those side effects, withdrawal symptoms, and post-use reactions.
So what is Depo withdrawal?
So Depo withdrawal, and that's a great question for my co-author. I'm going to do my best. Again, I'm not a doctor, but strictly speaking from experience and research, I would say that Depo withdrawal is a point after a woman stops taking Depo that her body is quite simply scrambling to regulate itself. A lot of women experience pregnancy-like symptoms. In my case, 8 months, even a year after stopping Depo, I was lactating. My breasts were so full and sore. I was lactating for several months on end. I don't know how many pregnancy tests I took. It was heartbreaking because I couldn't actually get pregnant. That nausea, the headaches, the sore breasts, anything that you would feel, in early pregnancy is very typical to feel, when you're coming off of Depo.
So just to be clear for the listener who's like, because I feel like this needs more emphasis. So you were lactating, like your breasts were making milk after you came off of Depo. And
it was a year after.
So it didn't happen right away? It happened, like it was like delayed?
It was delayed, yeah. So I had several effects, like several withdrawal effects. Felt like I was pregnant all the time. Nauseated, throwing up, the backache and sore breasts and all of that. But I was actually away on vacation. I was in Florida with my family, and I started lactating. So of course I thought, oh my God, I must be pregnant. And I took 3 or 4 pregnancy tests going like, what the heck is going on? At that point I had no idea. In the book, Dr. Poppy does explain why that happened. And it really goes back to the suppression of the adrenal glands and the HP axis.
I suppose that speaks to what's happening. And so one of the kind of fundamental themes that goes through the podcast over the 3 plus years that I've been doing this is that, as women, it kind of all starts in junior high because we're not taught anything about our bodies or our cycles. So we're not taught even that we're not fertile all the time. And then we're not taught that our menstrual cycle matters for more than just pregnancy. So essentially we're taught that the only time our period matters is if we're trying to get pregnant. And if we're not trying to get pregnant, then our period is totally irrelevant. And if we shut it down, there's not going to be any effect on the body. And so this seems to be
incorrect.
Exactly.
Exactly.
And so this is like the fundamental assumption that allows for this kind of stuff to go on. So if the fundamental assumption is that you don't need to have a period because it doesn't matter, then Depo is allowed to exist, and we're allowed to think that it's harmless to shut down a woman's period. From my perspective, I think like, wow, the lactating part is very kind of jarring. But if you pull the lens back, then it makes sense because we're disrupting the hormones. So maybe we can kind of even go back a little bit further. So for the listeners tuning in, we're throwing out words. We're throwing out the word Depo. And, I'm sure that a lot of the listeners are familiar with Depo-Provera, the injectable hormonal contraceptive. But for the listeners who aren't really that familiar with what it is and what it's made from and what the is it progesterone? Is it synthetic? Or just the very basics? Maybe you could start there and just share with us, what is Depo-Provera? And from what you know from writing the book and everything, like what is it actually doing to the body when we're taking it?
Depo is an injectable contraceptive. It's administered once every 3 months, typically in the arm or the buttock. It contains a synthetic hormone called progestin. Progestin actually mimics the natural hormone progesterone, but it isn't the same. progestin can have bad effects on us, like irregular bleeding, headaches, nausea, dizziness, etc. Well, we need the natural hormone progesterone for a wide range of bodily functions. Depo actually works by stopping the production of progesterone, and this is not healthy. It's also an anti-fertility drug, which is different from other birth control. The effects can stay, long after it's been stopped. And often fertility is slow to return, sometimes never returning. So if I could, take this just even a little bit further, how is Depo different from the pill and other contraceptives? Depo is, as I explained, it's a synthetic form of progestin or progesterone, which is called progestin. It can have negative effects on the body, but it's also a steroid drug, which is very different from the pill or other contraceptives. Many women don't respond well to its steroid, immune, and hormone suppressing effects. And in many cases, the damage that's caused by using Depo is irreversible and can be ongoing. Also different from the pill and other contraceptives, is that it is a steroid and, can cause a lot of long-term irreversible damage.
Well, and one of the things that you mentioned in the book, and I think this is, again, because this is the topic that I talk about so much, fertility and hormonal birth control, and of course, because I teach fertility awareness. But I remember, I forget who it was. It might have been Dr. Kyle Biter in an interview that I did. And, we're so cool to take hormones. So that paradox, so many women now are looking to green their diets, eat organic food, buy hormone-free meat, and, look for local, we're in this phase of health and all of that kind of stuff. And so a lot of women are now recognizing that severe issue. The word I'm looking for is just that fundamental issue with going organic and, non-hormonal meat, and then taking a pill every day or injecting Depo. And if you just imagine, like, if someone if you had some chicken on your plate, or if you're going to eat dinner and someone injects synthetic hormones into it, you'd probably be disgusted. You'd just be like, well, why would I ever eat that? But for some reason, we just don't think the same way of these hormones. And so one of the things that you talk about in the book is the black box warning on Depo. So first of all hormonal birth control has a black box warning. So I think that's helpful. And a black box, maybe you could share what a black box warning is and why they put it on drugs.
Well, I'm not sure that all birth control has a black box warning. I do know that Depo specifically does have a black box warning, and typically a black box warning is reserved for drugs that can cause irreversible damage and even, have lethal effects. And the reason why Depo has the black box warning, and that's been in place since 2004, is because it can compromise bone density, which can lead to osteoporosis down the road. And what's especially alarming is that, we're looking at, a lot of young girls taking Depo and using Depo when their bone density has not finished developing. And this can cause a lot of problems down the road. When we're talking about osteoporosis, when we're thinking about osteoporosis, perhaps in our teens and early 20s, you think, oh, osteoporosis, what's that? Maybe I'll have some soft bones, but you know what, really, it is quite a big deal. And, for the FDA to put a black box warning on this drug, it should be talked about. It should not be underplayed, and women need to know.
Well, and I'll just put out there that, so it may not be every single hormonal contraceptive. Like, I'd have to look at every single brand. The main brands, the ones that are popular, the ones that you know of. I mean, this is easy to do. Just literally Google it and look at every brand of hormonal contraceptive has a website. And if you go to those websites, you'll notice that they don't read like regular websites. So if I go to the Gap website, I have pictures of happy people selling me stuff. But if I pick whatever brand of hormonal contraceptive, it reads like a warning label. So combined hormonal contraceptive pills do have black box warnings, although Depo has the one for bone density. For the regular hormonal contraceptives, it's regarding stroke, especially for women who smoke, because there's a significantly increased risk of vein thrombosis and stroke and like death.
When you take, didn't know. Okay.
Yeah, so it's actually a real thing. So all hormonal contraceptives, essentially, so I'll put all in brackets. Maybe I should say most, because I can't confirm that it's every single one, but I know that all of the ones that, if you think of a couple brands, which I don't just want to just throw out, but I probably could, but if you think of a couple brands, the ones that come to mind, they all have the black box warning as well. It's just not for the bone density as it is in Depo.
Wow.
Yeah. So
scary stuff, isn't it?
It is. And so, I mean, the reason that essentially you're in this position is because the information that was given to you wasn't complete. So you weren't properly educated about the risks of Depo-Provera. You've talked a little bit about what some of the more common side effects are. I'm curious, what did your doctor say to you when you were, because I mean, so many women have taken Depo-Provera. It's a very common birth control method, especially for women who are looking for convenience, who, like myself, I was a horrible pill taker. And so I've never taken Depo-Provera, but I completely resonate with wanting to have a birth control method that doesn't require you to take a pill at the same time every day, because I was horrible with that. What education were you given, or what information were you given before you took it?
Minimal. Basically, I was sold on the idea of the side effect of your period might get light and eventually vanish. And for me, at that particular point in life, things were busy. I had tried several birth control pills previously in the past, and I had reacted negatively to all of them. So when my doctor said, well, there's this shot called Depo, and eventually you might not have a period, that was very attractive to me. I think from an instinct perspective, I hummed and hawed over it for months. So that would tell me that, I should have listened to my gut. It's not like something that I just, jumped on and did right away. I think it was a good 5 months before I actually took it. But if we're talking about information that was given to me, it was literally, you might want to take some calcium with that when you're on Depo, because it does affect bone density. But when you're talking to somebody that has no idea about bone density, and you're going, oh, okay, I'll take a little calcium, there was nothing else. Nothing else was discussed. And I know through years of speaking with so many women with their experiences with Depo, many, I would say most, I would go on a limb and say the majority of women were not told about the side effects, the black box warning, the withdrawal, and the post-use reactions. And when I became ill, first of all, I ended up in ER, the emergency department. I think it was about just after 40 days after my first injection. Doctors there want to correlate anything to my birth control. Even though I was full of infections I had never had before, I was terribly, terribly ill. And going back to the family doctor after that, there was no information, there was no insight. And I kept going back repeatedly with more and more problems. And if I was honest, I would have to share with you that he made me feel crazy. He made me feel like it was all in my head. And that is something else that is a commonality with past Depo users. There's so many women that, went back to their doctors with the same similar issues and were made to feel like they were crazy, that there was no way that it had anything to do with birth control. And still to this day, even in visiting with this doctor, I will just intervene. I've tried to change doctors here in Nova Scotia. There's a province-wide shortage, and that has basically impeded me to get a different doctor. So it's been very difficult for the last 8 years going back to this person over and over and over again who doesn't help and who is not very knowledgeable when it comes to Depo, when it comes to, the side effects and even post-use reactions years later. That's the reality here in Nova Scotia. And, it's sadly shared with many women around the world. We've all, most of us have experienced very similar experiences with doctors. They just don't know about it, and they don't know how to help us get better when we fall ill.
I feel two ways. Like, I'm happy that you're sharing your experience, because I know that there's women listening who've had a similar experience and you're giving voice to. And part of the reason that I go between podcast episodes where I interview experts and, doctors and naturopaths, but I also make a point of doing episodes with women who've experienced different things, and for them just to share their experience and to give voice to it. Because for a lot of women, it's the first time that they've received that validation. I'm actually not crazy. Someone else has experienced this too. And so if you don't mind, I actually wouldn't mind reading just a part from the book where you describe what happened after you got your first Depo shot. Because it's pretty,
absolutely,
yeah. So I'll see, it's a bit of a long section, but I'll see how I'll kind of skip over and things. My first shot was free. My doctor jabbed me in the left buttock. Almost immediately, I reacted negatively. According to Yen and Yaffe's Reproductive Endocrinology, a medical textbook, it takes only 20 minutes for the Depo shot to take effect. Confusion came first. It was difficult to concentrate and stay focused on anything. Within days, my urine was dark and cloudy, and I had pain at the site of injection. I had fevers that would come and go, and I got the shakes several times a day. I felt erratic and irrational. I wasn't myself. My head was in a fog, and I was having unusual headaches. I couldn't think clearly. Every day I felt a little worse, and finally I landed in the emergency department. And then you go on to describe that even though these symptoms started, shortly after you received this injection, the ER doctors wouldn't correlate my issues to my new birth control, but I couldn't help but wonder. By now my fever was dangerously high. I was constantly sweating profusely. It's just, the pain was so severe at the injection site that I could no longer sit on that side or walk without pain. By the time I arrived at the hospital, I was delirious. The fog had taken over. The doctors in the emergency told me I was full of infection. Quite literally, I had a bladder infection, kidney infection, pelvic inflammatory infection, and I can't even say this word, salpingitis, an infection and inflammation of the fallopian tubes. ER doctors also informed me that my body was full of E. coli, an infection that ultimately stayed with me for more than a year. I'm almost done. There's one part that I want to read. No wonder I wasn't feeling well. What I know now is that this was most certainly the effect of Depo-Provera. The drug strips immunity and leaves the user susceptible to infections and diseases. Depo also thins the vaginal tissue, which explains why the nurse asked me if I had been raped. At the time, I was puzzled by the horrific question. But what was even more baffling to me was why the doctors and nurses didn't know anything about Depo or its side effects and adverse reactions. I mean, what can you even say to that? That is horrible.
Yeah. Yeah. I'm feeling it right here.
It must be interesting hearing someone read it back to you, right?
It is, yes. That's a first for me. So yeah, what do you say to that, right?
There's lots of questions I could just imagine. So, the great interviewers of our time, this would be the opportunity where they would ask things like, well, that every woman doesn't experience this. Maybe you were just sensitive. Maybe you had a weakened immune system in the first place, kind of putting it back on you as though there was something wrong with you and that's why it caused it. However, if a person is healthy or relatively healthy, and then they receive a type of drug, and then all of a sudden it their body kind of starts falling apart. Well, we can't say, okay, whatever. We could talk semantics, but at the end of the day, if you hadn't had the shot, you wouldn't have had those reactions.
Correct. That's right. Bottom line. And I think too is and that's another part of all of the work collecting women's stories and, even the Twitter conversations online. I'm not the only one. And we couldn't all have been, there wasn't something wrong with all of us. Do you know what I mean? There's too many women that have had negative reactions, but I do get what you're saying, and the drug is poison and it needs to be taken off the market. There's just no way around it. It's caused immeasurable harm to so many women around the world from the get-go, from the trials. And it continues to be marketed in malice. I mean, it's been disproportionately pushed on women of color. poor women, institutionalized women, incarcerated women, women on government assistance, and in developing countries. Now, I don't fit in that demographic, but here I am. It needs to end. And I know that you do a lot of work, excellent work, bringing forth information on all of these other contraceptives that can cause problems as well. But from my standpoint, Depo really is the world's most dangerous birth control, and it needs to be taken off the market.
Well, and what's interesting is that, so especially coming from my perspective, whenever I teach a class about fertility awareness or work with a client individually, the very first thing that I do is I set the stage for the knowledge. So I don't just go into, and this is how you check for mucus. It would be nice, but the way that I start with in any situation is by laying the foundation so that we can all understand the way that the endocrine system functions, the reproductive hormones, how it works, and how it's all related to what's happening in the menstrual cycle. So, the hormones estrogen and progesterone. So estrogen characterizes the beginning of the cycle. And if you're not ovulating, you're not producing natural progesterone in any significant quantities. So getting the very basics, that's the foundation. What I find is that when I lay that foundation, then all of the other conversations that happen afterwards regarding whether it's hormonal birth control or whether it's, interpreting what's happening in the cycle now, it all comes back to a basic understanding of the reproductive hormone cycle and how those hormones affect everything else, and why ovulation is important, and why it is healthy, regular ovulation is a vital sign. And that is when a woman's body is healthy and normal, a part of that healthy and normal bodily function is regular ovulation. You can't separate those out. There's a spectrum of how bad, and Depo definitely does fall on the worst side. So the injectable contraceptives, they do have harsher side effects. So to hear your story is just devastating and heartbreaking, because it's supported by the literature. It's supported by the research. So a while back, I did an episode talking about what to expect when coming off of hormonal birth control. And I spoke about some of the research that talks about how long it takes for the menstrual cycle to return normally. And so there have been some studies that actually they'll go and they'll see, there was one study in particular that measured not just the length of a person's cycle, the woman's cycle, but it measured the different cycle parameters and actually gave us a good window into how long it took for the cycle parameters to get back to normal. And there's other studies that have been done where a woman comes off of a certain type of birth control and then she tries to get pregnant, and they see how many months it takes her to get pregnant. Well, in one of the studies that I looked at, regular hormonal birth control, it took women an average of 8 months, which is an average. But women who came off of Depo specifically, it took an average of, see if I remember correctly, it was about 16 months. So it was at least double.
That sounds about right.
Yeah. And so in my field, it's really we know. So the fertility awareness educators know that you can expect, so regular pill, you can expect at least about a year before your cycles kind of get back in line to normal. But with Depo-Provera, you can expect it to be 18 months to 2 years before your cycles start looking like they did before, kind of looking the same as a woman who didn't.
And that's on the assumption that there's no hormone imbalance.
Oh, and the assumption that they come back at all. Right. Because in my situation, I believe that I may have been able to save my fertility, but, I needed adequate care and I needed bioidentical progesterone. In the last 8 years, that has been the single-handed thing that I've done, action that I've done, something that I've taken that has improved my health. So I know that, for several years, and as you know, as we all know, you need progesterone to get pregnant. Well, if you have this underlying hormone imbalance, which is common after Depo, it can be 8 months, 16 months, 24 months. If you don't address that hormone imbalance, you'll never be able to restore your cycle. Mm-hmm. Well, and at the beginning of the call, you mentioned, so maybe you could elaborate a little bit. You mentioned that you lost your uterus. Did you have to have a hysterectomy?
Yes. So I not only did I have endometriosis and adenomyosis, which I did not have prior to Depo, an MRI showed that my uterus was actually inverted, tilted, and resting on my bowels. So that explains a whole lot of pain that I had been going through. It took them years to find that. Yes, I had to have a hysterectomy because of the endometriosis, adenomyosis, and the most specifically the inverted uterus, causing a lot of problems, as I'm sure you can imagine.
Yeah, no, I'm very sorry to hear that. It kind of in many ways it kind of sounds like what happened to you is almost, it's like literally the worst case scenario. Like you are the canary in the coal mine, because we know that not every woman has as negative of an experience as you did. But when you do the research, and so coming back to the foundation of just understanding how our bodies work. So when we're healthy, understanding the flow of hormones and what happens in the cycle and what's supposed to happen. So when you get that, then once you get a really good solid understanding of that, then if you understand how hormonal contraceptives work, so regardless of whether it's a pill or Depo, but in this case Depo, so Depo, it interferes with your natural hormones because it has to. And if it didn't do that, it wouldn't work as a birth control. So it has to do that. It has to prevent your endocrine system from functioning normally. So
and it suppresses it. So it stops natural production of progesterone, which can have ill effects on any woman. I mean, it's, like you said, that's part of what the action is as the birth control. But when you go and you stop the production of a natural hormone and suppress your adrenals, what does that do long term? And I agree with you. I mean, my case is severe. But I had a woman write into me over the weekend, almost identical to my situation. Endometriosis, ended up having hysterectomy. 20 years later, she's still suffering. Now she's got this and this, and women are writing in all day, every day, whether it's through the site or through the email or through Facebook or even online on Twitter. And it's common. So although, you're saying, I did have a severe reaction, many women are experiencing being forced to have a hysterectomy. Many women have lost their fertility. So, although from beginning to end, this is a horrific story, this is the story of so many other women as well.
Well, and by saying that, I want to be clear that I'm not minimizing what happened to you. It's when I say that, in your case, you had these reactions. So if you think about, so the book outlines beautifully pages and pages of all of kind of the possible side effects. So what I always say with hormonal birth control, the question is not, are you going to have side effects? When you understand how the hormonal cycle works, then you have to know that whenever you take a hormone as a birth control method, it's going to affect your natural flow of hormones. By the very definition, hormonal birth control is an endocrine disruptor. It disrupts the normal healthy functioning of the endocrine system. So the question isn't, are you going to have side effects? The question is, which side effects are you going to have? So you, Tracy, had these particular side effects, but every single woman who takes Depo-Provera or any other form of hormonal contraceptives are going to have side effects. The question is only which ones and how severe.
And you know what, I think that's a very, very good point. But I think if I could add on to that point, it's also important to realize that there are some women that actually they respond just fine to the Depo shot when they're on it. It's when they stop or years later that problems begin. And I've seen that time and time again as well. So just wanted to add to that.
Well, and the reason that I'm so emphatic is because even if a woman doesn't perceive herself to have side effects, I mean, you can do blood tests. Just as you mentioned, every woman is going to have lower progesterone. Every woman is going to have lower testosterone. These are things that there are studies that have been done that show this. So how a woman perceives herself on that drug is one thing. And so some women will say I didn't have any side effects. However, from a hormonal standpoint, every woman is affected.
Mm-hmm.
So, you know what I mean? Like, and I feel like it's really important to say that and for women to let that sink in, because I'm not saying that no one should ever use hormonal birth control, but it's what you said at the very beginning of the interview, which is that you weren't told about the side effects. Like, if you had been warned, if you had been properly advised, and if someone had really gone through, like if your book had existed and you had read it, and then you at least know, like, there have been women who take this drug who have this experience. Like,
well, that's
just
right.
To know that.
That's right. That's right. And I mean, that's why I've taken this approach with the informed consent, and I do talk about it, as often as I can, because that's an important piece to all of this. That's a human rights issue, and we need to know prior to using any drug, but specifically in this conversation, Depo and other hormonal contraceptives. We need to know those risks prior to taking it, because if we don't, it's not informed consent.
Mm-hmm. Well, and you put together, the pieces. So the reactions that you had, and the reactions that you've had since, so the withdrawal symptoms that you've described, you were able to kind of piece those together, and you have a sense that it was caused by the drug. So really and truly, in many ways, by informed consent, by actually advising women about all of the potential side effects so that she knows what they are. In all fairness, the drug companies do print out their warnings, and you can go to their websites, and they legally, they're required to let you know, although the wording on those are often meant, like, they kind of minimize possibility of mood changes, like you know what I mean?
Fluffy.
Yeah. But at least if you advise women of, like, okay, these are the side effects, then they know if this happens, it doesn't require a Herculean effort for them to kind of piece side effect A with drug B. Like, they know, okay, the doctor told me I could have this range of symptoms. I'm experiencing this, so I know it could be caused by the drug, as opposed to just thinking I'm just a lunatic.
But I think there's a disconnect, because the manufacturer of Depo has included most, if not all, side effects, and has outlined it in a clear, with a little bit of fluff, of course, as you just said, fashion in their product monograph. But there's a disconnect, because that information is not getting to users. And like my story and other women's experiences, not only were they not told, but then when things went astray, there was no information or insight from the doctor as well. So is it the fact that doctors don't actually read the product monograph? Do they not know about this, all of the side effects, withdrawal and post-use reactions? Do they not know, or are they not sharing that information? There's definitely a disconnect. It doesn't matter if you're in Canada, it doesn't matter if you're in the States, it doesn't matter if you're anywhere else in the world. All of the stories and all of the experiences that have come in, that is a commonality. I wasn't told, and I was made to feel crazy after when things went astray.
Well, and that's such an important question. In an interview that I did, so I'll link all of the episodes that I'm referring to in the show notes page. And Traci, I'm not sure if you have ever heard this episode. So I did an episode with a medical doctor. Her name is Dr. Miranda Naylor. And she didn't take Depo-Provera. She was on one version or another of the pill. And so her personal experience, so she's a physician, she's prescribing it, she went to medical school, and in medical school, so the answer to the question is, in medical school, doctors are trained to prescribe the pill because, or other hormonal contraceptive, Depo-Provera, whatever it is, because of their effectiveness. And so often the effectiveness is prioritized over the side effects.
Sure, effectiveness, right? But at what cost?
And I'm totally on board. But what's interesting about that conversation is, because she's a doctor, like a board certified physician, she shares her, because I asked her. So definitely check that out. I think it's episode 104. But I will.
Okay, I'm going to check that out.
For all the listeners who want just to hear from a doctor's perspective, like why are they prescribing these drugs? And because ultimately your doctor is not trying to cause you these problems, like these medical problems. Your doctor is actually, I don't believe that doctors are evil and they're trying to like destroy our lives. I think that ultimately from their paradigm and their perspective, they actually do believe that they're doing the best thing. And that's scary.
That is scary.
But it's an actual truth. It's a fact. The doctors, they are doing what they believe is actually going to be the most helpful thing for you.
So how would we explain then that they're not disclosing all of the information? Do you believe that they have all of the information? And they're just weighing the risks and benefits, and then when things go astray, they don't disclose any information and make you feel like you're going crazy?
I think it's fairly obvious and clear that the risks are completely downplayed and minimized. So it's a systematic, I think it goes really deep. One of the things that came to mind was the fact that, I recently read a study about endometriosis. So on average, in the United States, it takes a woman about 10 to 12 years before she actually receives a diagnosis. And in the UK, on average, it was like 8 to 9 years. So there's like a deep history of medicine in not taking women's complaints seriously. There was a time when the belief system was that men, period pain wasn't real. It was in a woman's head. And even to this day, it's only recently coming out that there was an article that came out saying like, period pain is as bad as a heart attack. Women have known this for years. Yeah. Right? This is not news. Right? Yeah. So I think this is a much deeper issue. I feel like this is like a fundamental women's rights issue that goes deeper than a doctor-to-doctor basis. I mean, fundamentally, the way that doctors are trained in medical school and the way that they are taught about birth control, the way that they are taught about the menstrual cycle, and the way that the side effects are completely minimized. So I feel like that episode is a good one to listen to, because I'm not advocating like for this garbage, but more so I'm just trying to understand. I come from a place of like, I want to understand because I actually don't believe that, even when my physician does things that are not good for me, I don't actually believe my physician is trying to harm me. And that belief of mine...
No, that's not what I was trying to say. Yeah. No, I wasn't trying to say that.
And that belief, the system that I have, it helps me. Because it clarifies to me that if I need to have support, I need to find a practitioner who is aligned with my values and my, like the type of care that I want. So understanding where your physician is coming from and knowing that their paradigm facilitates the prescription of Depo-Provera to women, because based on their paradigm that allows this all to happen is that the menstrual cycle is important, that you can stop a woman from having regular ovulation without any real side effects on the body. That paradigm allows us to go on.
I think that's an important point, is that, we need to take the reins of our health. And I think all too often, for whatever reason, we don't align ourselves with the correct doctor, with the right doctor. And we hand over that power and we follow blindly whatever the recommendations are. And like you had, said just moments ago, a lot of these problems, especially when it comes to hormonal birth control, is what doctors are actually being taught. So if you're, for instance, like myself here, but in Nova Scotia, stuck in a system that is, that we've got a shortage of doctors, I don't have that ability to find a doctor that correctly aligns with what my, needs are and thoughts and goals and health desires, and that's unfortunate. Surprising to me, to be honest with you, that, here I am living in Canada and I cannot get a new doctor. In all actuality, going back to your point, is we need to take the reins and we need to take control of our health. And if something doesn't feel right, and it's being dismissed, find somebody else. You're totally right. Align yourself with a doctor that you feel comfortable with, that doesn't dismiss your pains or concerns, and find somebody that you can work with. Mm-hmm. Right?
Yeah, no, I completely agree, because it's hard as women. It's hard because I feel like we're in a period of flux. I feel like from a historical standpoint, I mean, this is the first time in history when as many women are in the workforce, actually starting to make lots of money and having more power in the public sphere. So from a historical context, like, this is kind of uncharted territory. And so the system has not caught up. The system was not designed for us. And so we have to be the ones to advocate for ourselves. And it's not easy. It's horrible. It's hard. And so to kind of bring it back to the whole reason why you chose to share your story and you chose to write the book, what is the message? What do you want? So the listener who's listening to this, maybe there's two different questions. Like, one, the listener who's contemplating birth control, options. What do you want her to know? And two, the woman who has taken Depo or is currently taking Depo, what do you want her to know?
Whew. Okay. So the woman that hasn't taken Depo and is looking at Depo, there's a lot of resources out there now. And when I say a lot of resources, I say more than there was 8 years ago. Be strategic in your search terms. Don't just put in, Depo or Depo shot or Depo-Provera in the search engine. Try and investigate. Go a little bit deeper. So when you're, Googling, want to find more information online, be strategic. You put in Depo-Provera side effects, put in Depo-Provera lawsuits, put in, Depo-Provera problems, listed them in the book. There's also, of course, the book, The Dangers of Depo, the world's most dangerous birth control. I also have a website that I've collected a lot of information. There's a lot of great links, resources, that sort of thing. Do your legwork, do your research. Don't just follow blindly on the recommendation from your doctor. Take the reins, take control. Looking at the drug without all of the facts, it can be appealing. You're talking about not having to take a pill every day. I get that, but there's a price. And what's the price for that convenience? And if you're looking at taking Depo, just all I ask is that you do your research and, think about it and talk to other women, talk about their experiences and really find out for yourself what is best for yourself. For the woman that has taken Depo, and is that your question?
Yeah, like the woman who, because I always think about who's listening. And so I'm sure there's women listening who are like literally got their shot yesterday. Mm-hmm. And now they're just like, well, geez, now I'm basically, screwed, so are there any words of wisdom, hope, or for the women who are kind of in the midst of this and just are feeling kind of bad about their decisions or on the flip side, completely disagree with you and had a great experience with Depo and love it?
Mm-hmm. Well, I think for the woman that's scared, nervous, or, feeling the effects, you can reach me directly on the depotruth.ca website. There's a Let's Talk button there, and I quite frequently invite women to ask their questions, to speak with me, to even rant, just to get it off your chest if whatever is happening is stressing you out and you're not getting the acknowledgement that you would hope for from your doctor or your loved ones. I guess my message is that I'm here and I understand, and I'm here to help you get through it. In addition to being able to reach out on the Depo Truth website, you can always, reach out. There's 3 Twitter handles, and of course there's, DMs there. So there's Dangers of Depo, Depo Stories, and of course Depo Truth. And then there's the Facebook page. Of course, you can reach out and chat there. So I guess my message is that what is done, but I'm here to help you get through the next part.
Mm-hmm. Well, I mean, I feel like this episode is sobering. It struck chords. Like I could feel the energy between us. It struck chords in me. It struck chords in you. I'm sure it struck chords in the listener. We're talking about such it's just it feels like such an invasion, like of your own safety to take something that you feel that to take a drug that is like legalized and supposed to be safe. Like we trust our physicians. We trust this is Canada. Like, you know what I mean? Like we trust the healthcare system. We trust.
Right.
Yeah. Like,
That's right.
So it's such a violation of that trust to take something that turns out to be so dangerous and to find very little support for that.
That's right. And that's why it was really important for me to put that support out there, not only to put that information out there, but to be that ear. And like I've said to you before, there's constantly women contacting me, and I try my very best to get back to each and every one in a timely fashion, and just to try and be there for them. And like I said, sometimes it's just listening, and other times it's questions. But the reality is I'm not alone, and you're not alone. We are in this together, and you're right. It's a huge violation of trust. It is what it is, and I would just be elated if this terrible drug got taken off the market, because enough is enough.
Yep, I'm with you. Oh, well, thank you so much for being here, Tracie. On behalf of the Fertility Friday community, like I'm just so sorry to hear that you had to go through this horrible, horrible experience. And I think it's incredible that you were able to find the strength and the courage to speak out about it and to write a book about it and to try to be there for other women who've experienced similar, if not the exact same experience that you have. And so I really appreciate you taking the time to be here today and share your experience with us.
Well, you're getting me all choked up. Thank you so much, Lisa. I really appreciate you having me on the show, and of course, I appreciate all the work that you do for women. So thank you. I really appreciate it.
Of course. Thank you so much. Thank you for listening. If you enjoyed today's show, please share it with a friend. You'll find the show notes page for today's episode over at fertilityfriday.com/175. That's fertilityfriday.com/175. I hope that you enjoyed my interview with Tracie. I'm sure you could feel the electricity and the intensity as we were talking. You could tell that both of us have a real passion for women and just really want to share this story and just really get the message out there and the information out there. Of course, this is not to say that every woman who uses injectable contraceptives or any other type of contraceptives will necessarily have the same experience or even close to the same experience. But as I mentioned on the podcast, I think there's a misconception that only some women experience side effects. Hormonal birth control affects every single woman who takes it. When you're taking a hormonal contraceptive, it actually disrupts your endocrine system. It disrupts your normal endocrine function in some way or another, and that is the reason why they work. And so for anyone who's listening to the podcast and has been listening for a while, you'll know that I've talked about that a number of times on the podcast. And so it's really interesting because if you delve into the scientific literature about how hormonal contraceptives impact a woman's natural estrogen levels or her testosterone levels or her progesterone levels, it's very clear in the research that it's not just like some women have low testosterone and others are totally fine. Every woman across the board who's taking these hormonal contraceptive filled with different synthetic versions of progestins and estrogens, depending on the type, it does impact every single woman's hormonal profile. So you can't actually take hormonal contraceptives and not experience a shift in your hormonal profile and expression. What's different is how that's going to express. So for some women, they may experience painful sex. For other women, they may experience depression or anxiety or low libido. For other women, they may experience kind of more paranoia, intrusive thoughts. So it really depends. There's a whole gamut. Some women may experience like vulvodynia. And so I've done a number of episodes, what I call my pill reality series, where I actually interview women who share their own experiences on hormonal contraceptives. And the reason why I continue to share episodes like this one is because I've heard, being in my position, in my seat, being the interviewer, I've heard so many women say very similar things, and I feel like it's really eerie. For some women, when they go on a certain type of hormonal contraceptives, some women have this kind of immediate and abrupt experience where all of a sudden their emotions are haywire. And so in their case, it's quite obvious that, that particular hormonal contraceptive or hormonal contraceptives in general are not for her. And so that's one type of way that this expresses, but not every woman experiences that dramatic of an effect. I spoke to a significantly higher percentage of women who really, while they were on it, didn't really know or think that it was affecting them at all. And potentially in their case, the effects kind of snuck up on them slowly, or they just, because they didn't know that hormonal, birth control use is associated with these symptoms, they just thought that it was something wrong with them. And then in some cases, these women then went on to develop symptoms later on. So I interviewed a couple women who had panic attacks show up later on. And then for other women, they just really didn't know. And then it wasn't until they stopped taking the hormones that all of a sudden they felt like themselves again. All of a sudden they were back to normal. All of a sudden their strange thoughts, their paranoia, their anxiety went away. All of a sudden their panic attacks went away. All of a sudden their libido came back. And they didn't even know it was gone, right? Because many women are taking these drugs for such an extended period of time. So, of course, in this interview with Tracie, we're talking specifically about injectables, Depo-Provera to be specific. And unfortunately, a lot of women respond really, really negatively to the progestins in that type of hormonal birth control. And so that's why I feel really strongly it's really important to have a space to create that space where women can share their experiences, just so we can just tell each other, well, this was my experience. And it doesn't mean that no one should ever use Depo. Definitely doesn't mean that. Although, it'd be nice to be able to say something like that. But ultimately, every woman has to figure out what's going to work best for her. But it's more from the way I look at it, I think, well, at least if then if you happen to react badly to it, then maybe you'll be just, instead of kind of continuing on the path and continuing to use it for a really long time, but not really being sure if that's the cause, if you kind of know that, someone told me that I might respond this way, I'm having these negative reactions, maybe I should switch to a different kind, or maybe I should go off it for a while just to see how I do. I feel like when you have the knowledge, it just gives you more options, so that in those moments where you're not really sure what to do, if someone gave you the heads up that this could happen, then you're more likely to be able to take action and respond in a timely manner. And I think that's what is the biggest thing for me, is just to think that a woman could experience negative effects of a drug, and she has no idea that it's the drug that's causing it. And then she's on the drug for 5 years, 10 years, and it isn't until she comes off of it 10 years later that she realizes, wow, this is what this thing was doing to me. And so that's really at the heart of why I talk about this stuff so much. So I really hope that you enjoyed my interview with Tracie, and I'd love to hear your thoughts of it. I want to hear if you've used injectables before or any other type of hormonal birth control. I really want to hear what your experience was. So whether your experience was really positive, if you loved it, and if you had no idea that women had negative experiences because your experience was so positive, or if you had a really negative experience and you really felt like, wow, Tracie's talking directly to me. This was pretty much my experience, or somewhere in between. I want to hear what your experience is like. So if you're not yet part of the Fertility Friday Facebook community, make sure to head over to fertilityfriday.com/community, where you can get your invitation to join us in there. And I'm going to start a thread so that we can talk about the side effects. I'm always really keen to hear what real women's experiences are like, because I think that's where it starts. That's where change happens, when we actually start listening to the experiences of real women and just thinking about it, just talking about it, because many women experience different side effects and really have no place to talk about it and no place to share about it. And that leaves us all in the dark. So we got to shed some light on what's going on, what's really going on, the real story. And for those of you who are thinking about coming off of hormonal birth control, or if you've recently come off of hormonal birth control and starting to either consider using fertility awareness as a method or in the throes of it now, if you find that you need some additional support in interpreting your charts and even in just supporting your body to kind of transition off of hormonal birth control, and especially for those of you who are, in the midst of taking hormonal birth control, but really scared to transition off of it, it's really normal to be scared because, of course, if you're not yet ready to start a family, it's really important to have a method of birth control that you can trust. And if you're thinking about going off of the hormones, that's a huge shift. And so if you're looking for additional support in those areas, I offer a number of programs to really guide you through that process. And so I've worked with a lot of clients to help them transition from hormonal birth control into fertility awareness. And the thing about my programs is that, the goal is to really get you confident so that instead of having to, muddle through it for several months or a year or more, not really sure what the heck is going on, I, basically give you the shortcut so we can really get there in a couple of months and you are going to be really confident and have this life skill for the rest of your life. So for more information, head over to fertilityfriday.com/workwithme. That's fertilityfriday.com/workwithme for more information about my different fertility awareness programs. And so I want to send you a very special wish for the new year. I hope that you have an amazing year. I hope that 2018 is incredible. If you're listening in the future, whatever year we are in, I hope that you're having an incredible year. And I just really want to thank you all for tuning into the show, for supporting the show. There's so many podcasts out there you could be listening to, but you're listening to mine. And I really appreciate all of you for sharing the show with your friends. It makes such a huge difference in getting the word out. The more that you as listeners are sharing different episodes, whether you're sharing the whole podcast or whether there's a specific episode that would help somebody and you're sharing that, however you're doing it, I really appreciate it because ultimately that is what has kept the show going and that's what's been helping the show to grow over the years. And so you're all part of this incredible community. And as I always say, every woman does have to know how her body works. And so it's really important that all of us just keep talking, just keep talking about it. And I really believe that we're going to look back in, 10 years from now, 20 years from now, and the world is going to look different because as women, we're going to just start taking charge of our bodies and our fertility. And basically, I really believe that the world is going to be different as a result of this knowledge and information. And so with that being said, have an amazing year. And as always, be well and happy charting.